Hi, everyone. My name is Allie Mueller, and I work at Quill. I'm really pleased to welcome you to our first of 3 health interview sessions with Dr. Shannon Magari. Dr. Magari serves as Principal and Vice President of Health Sciences at Colden Corporation, where she helps clients determine the origin and nature of workplace health concerns, as well as providing litigation support in suspected cases of occupationally or environmentally induced illnesses. Moreover, she also serves as a visiting scientist at Harvard's T.H. Chan School of Public Health. Welcome again, Dr. Magari, and thank you so much for joining us today to share your expertise.
Hi, Ellie. Great to be with you again.
So during these sessions, Dr. Magari will be sharing with us her insights on flu and COVID vaccinations, COVID testing, and how to foster a safe workplace, as well as COVID safety during the holidays. So to kick things off, today we're going to focus on the first topic, which is vaccinations. So Dr. Magari, before we dive into vaccinations, can you remind us and give us a little bit of a rundown about your coronavirus work?
Sure. We've been helping clients sort of mitigate the risks associated with coronavirus since December of last year in the Asia Pacific and European markets, and have really tried to stay on top of everything. It's like drinking from a fire hose as a health and safety professional, but really with, again, the objective to try to mitigate the spread of SARS-CoV-2.
Great, thanks so much. So we're all excited to hear a bit more about the preliminary results from the Pfizer vaccine, and we just heard about the Moderna vaccine earlier this week. And I know that there can be a lot of confusion and maybe skepticism about how vaccines work. So maybe to kick us off, could you describe for us in simple terms what a vaccine is and how exactly it works?
Sure. You can think about a vaccination as sort of a training exercise for your immune system. So the first time you see a foreign bacteria or virus, your body reacts to it. You have three basic parts to your immune system, three types of white cells, macrophages, T cells, and B cells. And the first time you see that, your body mounts an immune response. You will generate antibodies to fight that illness and kick it out. So what a vaccination does is it imitates that vaccination process, where you'll be given, and there's 5 or 6 different kinds of vaccinations, but you'll be given a part of it to imitate that infection, to train your immune system, to give it some memory, so that the next time you see it, when you're exposed at the grocery store or wherever, your body is trained to understand and generate antibodies when it needs them, and get rid of that infection, or even prevent the infection, hopefully.
Nice rundown of how vaccines work. That was really helpful. So now pivoting more specifically to COVID-19, can you remind us what the status of vaccine development is there? And generally speaking, what's a realistic timeline that we can expect for the COVID-19 vaccine and its rollout?
Sure. So the current status right now, there's, oh my gosh, close to 150 different vaccines in various stages, from preclinical development to phase 1, 2, and 3 trials, and then early use authorization trials. So we start in preclinical studies, sort of in vitro in the laptop, then we go to animals, then we go to larger groups of people before they come out generally. There's 6 right now that are in that final stage. We heard about Moderna and Pfizer last week and early this week. And then quick behind the heels are sort of Merck and J&J, and there's pros and cons to all of them. 1 shot, 2 shots, how cold is it? What's the distribution strategy going to be? I think everyone should just prepare themselves. There's going to be multiple types of vaccinations throughout 2021, depending on your area and what's going on there. As far as rollout goes, obviously we're going to give the vaccinations to our healthcare providers, our frontline workers, first responders, ASAP, next few weeks, early Q1, that'll happen. And we'll start rolling into Q2 probably with the more vulnerable populations, so nursing home folks and those populations. And then I'd say mid-year, more widely distributed to the rest of us.
Got it. Sounds good. So because this everything is moving very fast with the vaccine development and potentially its rollout, when the vaccine is eventually available, how do we know it will work? And do you expect that the COVID-19 vaccine would be as effective as, say, our annual flu vaccinations?
Yeah. So how are we going to know if it works? So, and critically, how are we going to know if it's safe? Uh, Go hand in hand. The FDA has a robust process for the rollout and the testing, or the phased evaluations, and then even after it's rolled out, we're going to have substantial post-distribution monitoring, both for safety and efficacy, so that that network exists. People are actively working to, municipalities and state departments of health are actively working to get those monitoring systems up and running. Early indications for Moderna and Pfizer are that it mounts a tremendous immune response. FDA had set it at 50% reduction in infections. They're up into the 90s, so it's functioning much better than our regular flu vaccine, which is encouraging.
Yeah, that's very encouraging. I didn't realize that it was just 50% threshold, and we're seeing like 90% or above. So that's great.
But
So, a hypothetical example that I'm going to throw out next. So, let's say someone tests positive for COVID-19 and subsequently recovers. How long do antibodies last, and can that person be reinfected? And building on top of that, what is the importance for vaccinations for folks who have maybe recovered from COVID-19 previously?
yeah, great question, Allie. So, antibodies, circulating antibodies for this coronavirus are sort of looking just the same way that other beta coronavirus antibody longevity is. You know, titers up until maybe circulating concentrations, maybe 3, 4 months, and then they start to wane, pretty much disappearing by a year. Uh, Depending upon the virus, depending upon what kind of immune response you had, you may have some memory, which is what the vaccination is trying to achieve. But we are absolutely seeing documented cases of reinfection. So, and that's reinfection with different strains. So there's 6 strains circulating right now. People are getting one strain badly and then another strain mildly, or vice versa. But that database of reinfection is growing. So folks that have had it absolutely need to get vaccinated as well.
That's a really important clarification. Thank you. And once people are vaccinated, how long do they need to continue with mitigation efforts like mask wearing, social distancing, stuff like that?
This is pivotal, and I am shouting at the rooftops and to anyone that will listen to me. You know, the vaccine is absolutely a game changer. It's not going to be this magic wand that we're going to wave, and you know, the instant the first person gets vaccinated, we can stop all of these controls. We're going to need to be vigilant. We're going to need to be wearing masks. We're going to need to not gather. We're going to need to stay, you know, at least 6 feet apart for each other. I would suspect for the next 12 to 18 months. So the vaccine full rollout throughout 2021, probably even to 2022, until we have documented evidence how well it's working, until enough people get vaccinated. We need to get upwards of 60, 70, possibly 80% of the people vaccinated for it to really have the effect that we want it to limit outbreaks. So I think we're going to need to be in these controls for quite some time, certainly at least 2021, and perhaps a little beyond that.
Got it. Well, that's all the questions I have for today. So thanks again for coming and sharing your perspective on vaccinations. On behalf of all of us at Quill and for our customers, I appreciate you taking the time to join us today. And we really look forward to the next interview we'll have with you where we're going to talk about the ins and outs of COVID-19 testing.
Happy to help. Thanks, Allie.